My topic is cardiovascular diseases. Arteriosclerosis. Arteriosclerosis is the thickening, hardening, and loss of elasticity of the walls of medium-sized arteries because of excessive deposition of calcium, lipids, and hyaline. The arterial wall becomes thick and non-elastic, and the arterial lumen becomes narrow. So the blood flow through the affected artery becomes very slow or even blocked. Usually, arteriosclerosis produces no symptoms when it occurs in arteries other than cerebral, coronary, and renal arteries. Arteriosclerosis in cerebral artery cause cerebrovascular accident. In coronary artery cause coronary thrombosis and angina pectoris. Renal artery cause glomerulonephritis. Atherosclerosis and atheroma. Atherosclerosis is an extreme or acute form of arteriosclerosis. It is characterized by a degenerative condition of the arterial wall called atheroma. The arterial wall becomes thick, hard, non-elastic, and brittle with high deposition of cholesterol and other lipids in the form of plaques and knots. Very often, the atheromatic part of the arterial wall ruptures, causing hemorrhage and thrombosis. Causes of atheroma are high blood cholesterol level, hypertension, sugar diabetes, smoking, etc. Myocardial infarction. Myocardial infarction or heart attack is a very serious form of ischemic heart disease. Infarction is the death of an area of tissues due to lack of blood supply. Cardiac ischemia. Low supply of blood and oxygen through coronary circulation to a particular portion of the heart. Causes of heart attacks are ventricular fibrillation, coronary thrombosis, atherosclerosis, coronary spasms. Thrombosis. Thrombosis is the formation of blood clot or thrombus within heart or unbroken blood vessels during life. It obstructs the flow of blood. Thrombosis depends upon platelets, plasma protein fibrinogen, different enzymes, clotting factors, and calcium ions. Indirect causes of thrombosis are some damage to the smooth lining of heart and blood vessels caused by inflammation and atheroma. Coronary and cerebral thrombosis are very serious. Coronary thrombosis. It occurs in the coronary artery. It appears great pain in front of the chest or in upper part of the abdomen associated with pallor, feeble pulse, and breathlessness. Coronary occlusion. The clot within heart increases in size and blocks the flow of blood. If the occlusion prevents the flow of blood to a large area of the heart may stop beating. This is called cardiac arrest. If only a small area of the heart is affected, heart may continue functioning. Causes: smoking, obesity, diabetes mellitus, high BP, etc. Cerebral thrombosis. It occurs in the vessels to brain. It causes apoplexy or stroke in people whose arteries are much diseased.